Hello, this is Kim from the Community Education and Training Department at Mercer County Community College. You are about to listen to our podcast called Adult Learners Steps to Success. In our monthly podcast, we will be discussing topics such as interviewing tips, employer expectations, the job market, and much more. Our number one priority is to give our adult learners the education and the tools they need to succeed. Enjoy the show. Hi, this is Kim, your podcast host, and today we have the pleasure of speaking with Emily Baggett from Trenton Health Team. Emily, let's start by you telling us a little bit about yourself.
My name is Emily Baggett. I'm currently the Senior Director of Policy and Strategy at the Trenton Health Team. I've been with THT for 4 years. Actually, this month, it's been 4 years. I have a health policy and government background. I've lived in New Jersey now for over 7 years. I'm originally from the Chicago area and I live in Mercer County. I have 2 young children.
Boys or girls? What do you have?
My daughter is 5 and my son just turned 3.
You do work for Trenton Health Team. Can you just tell us a little bit about who Trenton Health Team is and what they do for the community?
At our core, we are a multi-sector partnership. We were started by the 4 main healthcare players in the city of Trenton: St. Francis Hospital, Capital Health, Henry J. Austin, which is the local federally qualified health center, and the city's Department of Health and Human Services. So we started as a means to facilitate data sharing and collaboration and working towards common goals. We have grown significantly in the last 10 years. So we have a broad mission to improve health and well-being in Trenton. We do that through a variety of strategies, everything from data to communicating health information to working directly with community members through a care management team. We have other programs that look at connecting partners around key issues of concern like food access or maternal and child health.
I would like to focus in on one of your programs specifically called Family Connects. I did a little research on this. What a great program for new moms and dads. Can we start off by telling us a little bit about that program?
Family Connect is a unique home visiting program for the families of newborns that provide a comprehensive home visit, although right now we're doing them virtually, to families of newborns at around 3 weeks, the infant's 3rd week of age. The program was started in North Carolina. And one of the things that makes it so unique relative to some other home visiting programs is that this is truly for everybody. We know that bringing home a new baby is a vulnerable time for all families. Unlike some of the other home visiting programs that have income limits or are serving families who are having their first child, Family Connect is really for everyone. Looking at the health of the birth parent, the health of the infant. Does this family have a medical home? How can we support this family and connect them to longer term resources? Maybe that's breastfeeding support. Maybe they need to find a pediatrician. It's truly comprehensive and can help the family with whatever support they're looking for.
Who qualifies for this?
Right now, this is open to Mercer County residents who deliver their baby at Capital Health Hospital.
How would a new mom apply for this? Like, how do new parents apply for this program?
We are actually fortunate enough to be doing the recruiting and the enrolling for the program at Capital Health. Right now, we are in a soft launch period, so we are not visiting every single family that delivers, but we do have an enrollment specialist who is at Capital Health. She speaks both English and Spanish, and she is visiting the families as they recover from the birth and enrolls them from the program right in the hospital.
I did read that New Jersey ranks amongst the worst states regarding maternal and infant health. So this a fairly new program. I believe you started it in 2020 or 2021.
We started the planning for this program in 2020, and then we launched at the very end of 2021.
The benefits of this program is awesome. You read about and you hear horror stories and some women and single moms that could really use these kind of services that give them direction and guidance and help. I just think this program is wonderful, especially postpartum. Checking in on some somebody with postpartum is so important, especially again, if it's a single mom. This plan is just wonderful.
I truly think that everybody who brings home a new family member can benefit from support, whether they have lots of other support, but maybe need some help breastfeeding or need some connections to support groups, or the issues that come up in the postpartum period really affect everybody. This is not intended in any way to take the place of the regular pediatric visit or going back to the OB for the 6-week checkup visit. It's not intended to be duplicative of that. Here is a knowledgeable nurse who can spend 90 minutes or 2 hours with the family and talk through some of those things that might not get addressed in the shorter provider visit.
It's so beneficial. And how about like just new parents alone? They don't know what to expect, meaning new parents with the firstborn. They have no idea. You can read as many books as you want, but until you're actually put in that situation, there's a lot to learn. And I don't think enough people know about all the resources that are out there. So getting the word out about Family Connects, I think, is wonderful. Can you talk about any future projects you have in the works right now?
Across Trenton Health Team, we have lots of programs and projects that would make this podcast way too long if I listed all of them. But I would encourage anyone listening to check out our website, trentonhealthteam.org. There's links to follow us on many of the popular social media platforms. And that's a great way to stay abreast of vaccine events, COVID test updates, health fairs, different programs we have on health education. That's a great way to keep up on what's going on at THT. And I would encourage folks to check out our website and check out our social media.
Even more specific, the phone number for Family Connects is 609-337-4317, or you can send an email to familyconnects@trentonhealthteam.org if you want to know specifically about the program that we are talking about today. Emily, I can't thank you enough. You've given us some great information to share. I really appreciate you taking the time to come on today. And I look forward to speaking with you in the future about some more projects coming up. And again, we encourage everybody to check out that website, trentonhealthteam.org, to see all the many services and programs that they offer. Emily, thank you very much. And I hope you have a wonderful day.
Thank you.